مساء الخير عليكم جميعا. معكم عبير صقر من هيوستن تكساس، واليوم رح نعمل انترفيو حلو كتير مع دكتورة هداية زيا، أخصائية التجميل للوجه والرقبة. الدكتورة من لوس أنجلوس، أخصائية رائعة ورح تحبوها كتير. عندي أسئلة كتير إلها بخصوص عمليات تجميل الوجه والرقبة. طبعا هذه عمليات تعتبر عمليات تجميلية للي بيعتقد انه هو بيحتاجها، وفي ناس كتير لا تؤمن فيها وبتحب انه هي تفضل على طبيعتها. بس اللي بدي اقوله انه عمليات التجميل الوجه والرقبة في الوقت الحالي الان صارت مثل ما بنشوفها صارت طبيعية اكتر، وصار الاسلوب في تنفيذها متقن اكتر في اغلب الاماكن، طالما انتم اخترتوا الجراح الصحيح. رح نضيف معنا هلا دكتورة زيا. اتمنى انه هي تدخل معنا تشاركنا، او انا رح الاقيها هلا. خليني to invite her معنا. هي رح تشاركنا من نسألها الأسئلة المفيدة. أهلا وسهلا فيكم من كل بلد عم بتشاركوني فيها. أنا مبسوطة كتير إنه أنتم معنا اليوم. اللي عنده أسئلة في الفري رح أحاول أحكي عربي وإنجليزي. إذا في حد ما بيقدرش يفهم الإنجليزي كتير كويس، وأهلا وسهلا. اللي بيحتاج مني أي سؤال أو عنده أي موضوع خارج الموضوع اللي بدنا نتكلم فيه اليوم، في يبعث لي رسالة على الخاص وبنتابع إن شاء الله بعد الفيديو. أنا عم بستنى دكتورة هدية تدخل معنا على الأونلاين. مين فيكم عنده استعداد يعمل عملية تجميل للوجه؟ أنا بعرف إنه في أغلب الناس بتتجه للبوتوكس بتتجه للبوتوكس وللفيلرز، وفي عليها مآخذ كتيرة البوتوكس والفيلر. فبالتالي لأنها في منها دائمة وفي منها بتغير بشكل الوجه أو بتعرض فيه، بالذات الفيلرز. وطبعا مثل ما انتم عارفين انه احنا لازم نكون دايما حريصين انه احنا ما نستخدم الفيلرز الدائمة، وهذه لحالها بدها موضوع تاني كامل نتكلم فيه، لانه فعلا عم نلاحظ انه ناس وجوهها عم تتغير أكثر عن اللزوم، والملامح بتتغير أيضا. الفكرة من التجميل دائما هو فقط إنه إحنا نشيل علامات تقدم العمر قد ما الشخص بيحب أو قد ما هو بيريد. فبالتالي بالتالي لازم تكون شكلها طبيعية، ولازم تكون غير مبالغ فيها. هلأ المبالغات الزيادة هذه حاجة تانية. Hi, I found you. I was looking for you.
Sorry, how are you?
I'm good, good. Thank you. Thank you so much for joining us.
Oh my God, thank you for having me. It's such a pleasure.
Number one, you look like a child, so I need to convince them that you are an amazing surgeon.
Well, our skincare products are working.
Yeah, that's true. That's true. It's all about skincare and how much we take care of our skin.
Yeah, I mean, it plays a huge part. I mean, often people are kind of worried about kind of deeper things, but the first kind of biggest thing that you see is your skin. So we often encourage our patients to really take care of their skin and kind of take care of that before anything else.
Absolutely, absolutely. And if you
I mean,
allow
so
me,
are you.
I'm gonna be speaking English, but I'm gonna flip to Arabic in a quick periods, just in case someone doesn't understand English from our dear viewers. So I see that everyone is going active. Yourself, Dr. Hedyeh, can you tell us in a short way what do you do? What kind of surgeon are you, and what kind of surgeries do you usually do?
Yeah, I mean, I'm a facial plastic surgeon here in Beverly Hills. I'm the medical director at Beverly Hills Hair Group with Dr. Ben Tale, and I'm an associate at a surgical center, Beverly Hills Center. So I focus on facial rejuvenation and the aging face. So predominantly facelifts, neck lifts, brow and kind of periorbital rejuvenation, lip lifts, and rhinoplasty. I did most of my training back in Canada from Toronto, and then I moved here for my fellowship with the AFPRS, of the Facial Plastic Academy of the States. And then I did it under Dr. Bentale, Richard Zumoulin, and Dr. Deer, and I stuck around after fellowship and joined the practice. So it's been incredible to stay here.
Right. Well, Beverly Hills is the mecca of plastic surgeries, and I know there's a lot more wonderful surgeons all around the world that have learned and got into all the most advanced techniques in facelift and neck lifts, and also we include the eyes and the eyebrows. So let me ask you my first question. Who qualify for a facelift? Because we usually talk about it like as if it is a diagnosis, but who qualify for a facelift? مين الشخص اللي بيحتاج عملية شد الوجه؟
Yeah, I mean, that's a great question. And I think it's the paradigm for facelifts have actually changed quite a bit in the past few years. And I think it's partly due to advances in techniques. So Dr. Talley, who I did my fellowship with, he's really changed the facelift technique. So we do a type of deep plane facelift, which is quite substantial in the fact that people get amazing changes, but it's very natural and long lasting. So this has really changed the age for patients coming in. When it used to be patients waiting until their 60s or 70s, you see patients coming in usually in their 40s or 50s, and even sometimes in their late 30s with skin problems and just increased laxity. So, I mean, the ideal candidate is someone who's had changes in their face, whether that's volume, deflation, whether that's descent from gravity, problems with their skin. So sometimes it's done just for acne, and kind of show signs of aging. So whether that's kind of concerns about areas around their neck, decreased kind of jawline definition, neck, your angles in your face, and volume, of course. But I think a big part of kind of face and neck lift, at least for me and my patients, is when patients are ready. So what I say to my patients is when it starts to bother you, when it starts to kind of prevent you from being happy, from being confident, from taking a photo or a selfie. Are we going, or are we on the circle of death there with the loading? I think I might have lost you there.
Yeah, I got you. Sorry.
Oh, good. Okay.
So,
So I was kind of
in Arabic, what I'm gonna say, Dr. Zia saying that بتقول إنه اللي مؤهل إنه هو يعمل عملية تجميل الوجه الشد ممكن يكون لأسباب مختلفة في أي عمر كان. حتى الناس اللي عندها حب الشباب وتارك علامات غميقة ممكن يستفيد من عملية شد الوجه. طبعا التقدم بالعمر، الجلد الزايد أو الترهل في الوجه بيحتاج برضو عمليات شد للوجه بحيث احنا نعيد له النضارة بس ما بنغير في الملامح. So go ahead.
So I guess, and then just kind of expanding on kind of the patient factor. So patients that are really bothered by this, patients that are essentially kind of limiting their life. And I think that we're seeing that more and more with social media, with Zoom, especially during COVID, where people were kind of staring at their faces and necks all the time and kind of analyzing their face. I think it's a great opportunity for patients to kind of put a revamp on their life. So the best texts that I get are from my patients in their early recovery saying that they love taking photos, they love being on camera, they love going to social events, and they can't even find a before photo on their camera to show me, like a selfie from before and after, because they never took any photos. So I guess for me, it's those kind of patients that are really impacted by it and obviously show signs of aging and show areas that I know I can help with surgery are the ideal candidate.
Also, patients who had severe weight loss, you know that, don't you agree? A lot of people who had went through surgeries for weight loss, they lose a lot of volume in their face, and suddenly they see themselves that they look older, although maybe they are 45 years old, and then they become saggy and the neck get affected, and I think they just don't know what to do about it, and they regret the weight loss, although the weight loss is good and healthy, but then they need to do more touch-ups, and at certain point fillers and Botox does not help. To what limit does Botox and fillers helps to tighten the skin?
Yeah, I mean, Botox is a neuromodulator. Obviously, it works to relax muscles. So I wouldn't put that in the category of kind of areas that we're improving with facelifts. It definitely improves kind of in the area here when you hit these muscles. You get improvements in the smile and it's less downturn or frontalis. But what you're able to achieve with Botox really isn't kind of what we're trying to achieve with facelifting, and the same with fillers. Dr. Talley, I mean, there's a lot of controversy about fillers, but we do like fillers. We think that volume augmentation is great. We use it during our surgery, but you're not supposed to fill in order to lift. So you're not supposed to add, for example, like 10 cc's or 10 vials of filler in order to lift the face. You don't lose that much volume in your face. We definitely supplement our facelifts with a little bit of volume, but filler could only go a long way. You can't expand this way enough in order to get a bit of a lift. The way we lift is that we release everything and we lift everything back to where it's supposed to be. But it's not by overfilling in order to
So
get
I'm
that
gonna
lift. There's only
say
so
that
much.
in Arabic. So what she's saying بتقول الدكتورة إنه إنه نملى الوش بالحقن بالفيلرز ما بيرفع الوش، ما بيشده، بيزيد من كأنك زدت في الوزن أو كأنك زدتي في الوزن وتملى الوش، لكنه ما بيرفع أو بيشد البشرة. ففي فرق بين إنه إحنا نعمل فيلر علشان نشد الجلد اللي مرتخي عنا أو المترهل، لأنه مش هو الحل إله. ولا حتى الحقن البوتوكس بيساعد أبدا في رفع الوش أو بشده. هو ممكن يكون للتحسين، ممكن يضيف بعد العملية بيستعملوه أيضا، ومن خلال العملية بيستعملوه سواء باستخدام الدهون أو باستخدام الفيلر، بحيث إن هم يحسنوا من شد الوجه، ولكن لا يستخدم كطريقة لشد الوجه بسبب الترهلات. So yes, I agree with you. It actually adds more to the volume, and it changes sometimes the features of how a person looks when they overfill their face.
Yeah, I mean, with our surgeries, I mean, there are huge changes in people's kind of transformations, but we say it's not transformative surgery. It's great, and it's patients look more refreshed, they look more youthful. Oftentimes, if you wait until the 3 month mark, we have patients that go to their family members and they can't tell they had a facelift. They look at them and they say, did you go to the spa? Like, you look so good. What's happening in your life? I actually had a recent patient. Someone asked them if they had a rhinoplasty because they were like, "You look so good, but we just can't tell what it is," which was so funny. I know. I was like, "This is
This is
amazing."
beautiful because it wasn't like that before. We used to
Yeah.
see the people with facelift that they are so tight and they are so pulled, and that turn off a lot of people from facelift. And I think the pulling part of the face is not there anymore in the advanced surgeries that you guys are doing.
Yeah, I mean, there's definitely been advancements, and I think the modern kind of best technique. I mean, I'm obviously biased because I did my training with him, but Dr. Talley has really changed the facelift. It's a deep plane facelift, which you hear all over social media. You hear it all over, and it's used as a marketing tool, but it just really means that you're kind of going in this layer that's deep to kind of this SMAS tissue and down in the neck under the muscle, and you're lifting everything as a composite, as a unit all together. Previously, people would go in, kind of pull on it, pull on the skin, pull on everything together. So you're not really releasing everything. You're relying really on just pulling, tightening, like anchoring stitches and stuff like that, which is not the technique anymore, or at least not the technique in our hands. The way we do it is we go in and we focus really on releasing any kind of attachments or anything, which makes it more long lasting and makes it more natural. Your suspension or your lifting isn't attached to your facial muscles. So everything's kind of released in a plane in which you age in. So our patients never look pulled. Our patients never look unnatural, or have kind of issues with like differences or the looking different than how they were before. They look more refreshed. They look happier. They look more relaxed, and that's how they feel. And it's great to be able to provide that and kind of show them like how like their outside kind of represents how they feel on the inside. So it's
So
something that's really
So,
changed.
what is the preparation for a person who wants to do a facelift? Is there something before a facelift that the patient needs to do, or are they just the regular testing and they go on to surgery? Is there anything they need to prepare a few months before?
Few months before, I mean, just making sure you're a good candidate for surgery. So having a consultation, making sure that along with the surgeon, you kind of are on the same expectations. Really, it's very minimal preparation. The only thing is we ask patients
alcohol.
no smoking, alcohol we ask for 1 week before surgery. The only thing really is no smoking, and then weight loss. So if you're expecting to lose any weight or gain weight around 50 to 20 pounds, we tell you to hold off until you're at a stable weight, and then that's really about it. The rest of the preparation is quite easy.
Oh, so let me say those three main things. الدكتورة بتقول إنه 3 حاجات لازم ناخد بالنا منها قبل عملية شد الوجه، اللي هو نوقف التدخين على الأقل 6 أسابيع، الكحول أسبوع، وبعدين إذا ناوي أو ناوية إنك تخسري وزن، إما بتخسري الوزن قبل العملية، بالذات إذا خسرت الوزن فوق 10 كيلو لازم تخسريها قبل أو تخسرها قبل عملية شد الوجه، أو بيصير في عندك ترهل مرة تانية بعد ما تخسر الوزن بعد عملية شد الوجه. How long does the surgery takes? Just let's talk about a basic surgery of just a facelift.
Yeah, so our facelifts go with the neck lift. So I never really perform an isolated facelift without the neck lift. Everything kind of comes up together. Around patients come in the morning of, and surgery takes about 5 to 6 hours on average.
I see. And how long is recovery after this type of surgery, and what is the level of pain?
Yeah, so pain is minimal. So the only thing that we do that's painful is the brow lift, which patients get a migraine for about a day or two, and it's usually not too bad. The face and neck lift is very minimal pain. We give kind of pain very tight in the neck, which is something that we like to hear. So we say we want to hear that you're tight, you feel tight in your neck. But other than that, there are no discomfort and there are no pain. It's actually quite outstanding. Like patients, like they look like they have a little bit of bruising and stuff, and they look like they should be in pain, but they feel really awesome.
The swelling, how long does the swelling last?
Yeah, so it's variable. We usually tell patients that they look a bit bruised and swollen for the first 3 weeks on average. After the first 3 weeks, we say patients are passable. So we say you could put some makeup on, you could go to the grocery store, no one's really going to stare at your face. It doesn't look like you had a facelift. People that know you are going to know you look different at 3 weeks. But to an average person who doesn't know you, you might look like you have a little bit of swelling.
Yeah, you're generous with your conversation. I've seen a bunch of your patients, and goodness, they could go out after 2 weeks, and they have not talked about pain even, and that is really, really surprising because we think the face is too sensitive for any kind of surgery. So you would think that it will be painful procedure, but from all my experience with you all, like it is very minimal to pain, and even swelling. I think is the most I saw is maybe the first 10 days of big time swelling. And I noticed you guys added drains, right?
Yeah.
How long does those drains last after
Yeah,
surgery?
so we take off. So thank you so much for saying kind words about my patients. So the drains come out the next morning. So we have a big head wrap. We tell them they look like a big Q-tip overnight with the 2 drains. But then when I take off the head wrap, the drains come out. So patients oftentimes don't even know they had drains in.
Oh, very interesting. So the tissue recovery is not going to require more drainage, because I know with other parts of the body, they do keep training for drains for 2 weeks at least.
Yeah.
So with face lift, they don't need to keep it for that long.
Yeah, I mean, there's various surgeons that do keep drains in for longer. Body surgery is a bit different. They're more prone to having seromas or collections. So that's different. With that face and neck, the way we do it, the purpose really of the drain is to keep everything kind of sunken down. And because of our advanced techniques, there's very limited area that has like a dead space in order to collect any fluid. So the drain is just really there overnight, and that's really about it. It's just there's not much kind of area for anything to accumulate. So it's
so there is no such thing of just a neck lift. This comes combined, the face and neck, the lower face and neck, they are all one part of one surgery, correct?
So there is an isolated neck lift. So I don't perform a facelift without the neck because oftentimes everything's together. But the contrary occurs. So patients in like their 20s, 30s that have poor anatomy, or they just have essentially isolated neck concerns. That's often congenital, or they've just always had this like double chin, and it's oftentimes in people that are much younger and don't have any signs of aging. It's not because of aging, it's just their anatomy. So we do an isolated neck lift. So it's essentially the neck portion of our face and neck lift, and then it's just cuts kind of under your earlobe back in there, and then a small one under the chin, and nothing on the face, obviously.
So what about the total facelift? Where is the lines of the surgery is going to be?
Yeah, so it's the same ones that we talked about for the neck lift. So under the chin, it just extends from your temporal hairline. So it follows kind of your temporal hair here down into your sideburns, either right in front or right behind this ear cartilage, under the earlobe, and then back into the hairline.
And how about those scars? Do they leave a mark? Do they leave a scar? I mean, you're talking about an area that is here. It's very obvious. So how does patient do with scars after that?
Yeah, I mean, anytime you make a cut on someone, you're going to have a scar. Our scars aren't visible. We don't say they're invisible because obviously, if someone's looking for it, I can see scars. But to the average person, they heal very well, and it's partly because of our technique and kind of our post-operative care. We laser all our incisions with the CO2 laser at 6 weeks and at 3 months. And usually at that 3-month mark, 95+% of our patients, that's all we need to do. Sometimes we need to do a little touch of another touch of a laser, some kind of scar kind of management. But the scars for the vast majority of patients are not visible or do not cause any significance in their kind of appearance.
I see. So, what is the best things that the patient can do after the surgery? What is that they need to take care of? Of course, no heavy lifting, no tanning in the sun. What else?
Yeah, so it's our post-operative care is pretty straightforward. We don't make it too complicated. We encourage all our patients to do hyperbaric oxygen. So we have 3 chambers over here. So we tell patients to do hyperbaric oxygen as much as they can, especially during the first week. They have stitches in kind of their face that we see them for a few times during the first week. All your stitches are out at a week, and patients, if they're coming from out of town, they can leave town after the first week and travel back to where they're coming from. We do patients they feel great, and they could walk around the aftercare at home at the hotel from the first day. So patients are walking and about. We tell them that after 3 weeks they can do light cardio, so going on the treadmill, doing some light kind of elliptical. And then at 6 weeks they're totally unrestricted. They can do whatever they want. They could go skydiving, scuba diving, jiu-jitsu, whatever it is that they want to do. At 6 weeks they're back to total activity.
So we're saying age doesn't matter. It is if the person, so we used to say like, oh, you need to be above 50 or 60, or we notice people at over 70, they do facelift. I mean, I'm noticing right now that people at any age they're doing, I'm noticing 40 years old are doing. Is there any disadvantage of a 40 years old who believed that he needed or she needed a facelift? How long does it last, and is there like anything that is too early for a facelift, or it depends?
So great question. I mean, I get that asked quite a bit. No, there's no age that's too early for a facelift. It really depends on kind of the patient and also kind of areas that we think we can improve. So if they show signs of laxity, aging, descent that I know I can improve with a facelift, and they're ready for a facelift, then we do the facelift. The youngest patient I think I had was 38.
Wow, that's
They're
young. So why did this patient decide to do facelift?
They were just concerned with their nasolabial folds and kind of descent and heavy lower face, and kind of lack of definition in their neck, which was partly kind of from how they were from younger, but also from signs of aging. So that patient was excited, was very excited and did very, very well. And she says that her life's changed, and she had her birthday recently, and everyone thought she was like in her early 30s, and she's so excited about it. But no, there are no negative consequences from doing a surgery. We say that the surgery lasts about 10 to 15 years. So if patients
So after
get
10 or 15 years, is it gonna age as if like if I'm 40 and I'm 55, am I gonna look like 55 suddenly? Am I gonna sag and age? How does the aging comes after a facelift?
well, you look 35, so
No, thank
congratulations.
you. I
Um,
appreciate it.
no, we just reset the clock. So it's not like the lift lasts like 10 years and then all of a sudden falls.
Yeah.
You reset the clock, gravity, deflation, stuff like that still kind of happens, and it's slowly over time kind of just descends. It's not like you end up back to where you started from. It just kind of
Yeah.
resets the clock. So everyone ages differently. That's why
Mhm.
some people, they look amazing when they're in their 50s. Some people kind of show signs of aging earlier on. So it's just on average, from what I've seen, is about 10 to 15 years. And it's the exact same surgery that we repeat. So there's no kind of downfall of doing a facelift earlier and then repeating it at 10 to 15 years. It's the same surgery. We use the same incisions. So the patients do really well.
So I see someone saying surgery doesn't always make you look younger. So what else does it, if it's not making a person looking younger, what else is it beneficial for?
I'm,
Just to entertain this
I'm
question.
I mean, it depends on what kind of surgery we're talking about. Surgery can be medical. So, I mean, patients that come to me often want to just look more refreshed, want to look less tired, want to look more like how they feel on the inside, and usually want to say they want to like set the clock back a few years. They show me photos of kind of their youth, and they say, look at the way kind of my face and my neck was, and can you help me kind of get back to that? So in the surgeries that I do, I mean, especially with the aging face, definitely patients look younger. I would say less so in other surgeries like a rhinoplasty. It's not necessarily to look younger, it's to look more beautiful or have a kind of a softer nose that kind of blends into your face more.
So what do you think of, I'm sure you see all kind of patients. What about people who are coming to you, they want to change how they look? How do you entertain that? Like a person who doesn't like how they look, and it's like a dress or like a suit. I wanna shave it from here. I wanna be more pointy here. I hear all that from concerns from women and men too. So, how do you entertain facial changes, like um, to someone who's asking that from you?
Yeah, and that's a really good question. I think it's just seeing kind of what their concerns are. I don't do ton of changes in patients
You,
kind of like to look
you
different.
guys
So
shave the area here. I heard about shaving of this bones of the jawline and all.
I personally don't. There are surgeons that do it. I don't do a lot of kind of transformative surgery. I like to kind of keep patients the way they look, just enhance them. But that being said, there are kind of obvious kind of, not, I wouldn't say like deformities, but there are obvious, like if patients are kind of concerned about like a recessed chin and they want to add some volume and they say, doctor, I don't love my chin. Then like we add some volume there. Or if they're kind of, they're flat in the cheek, you add volume there. So there are kind of patient concerns or kind of changes if they're requesting it. If it's in keeping kind of with my aesthetic goals as well, then I definitely have a conversation with them and make sure kind of we are able to achieve the same goals. But I don't like patients. It's actually, it's very funny. A lot of patients like bring their younger pictures and they're like, just look at my jawline, look at this, look at that. And I'm like, no, I'd love to see your photos. It's so great to see it, but it doesn't change anything in my surgery. We still do the same surgery. I still lift it to the best that I can. There's not like, it's not trivial. Like when you're in surgery, it's not like, oh, let me think about what I think she would look like. I'm not trying to change the shape of their face. I'm not trying to change the shape of their eyebrow. So I love to see photos, and it's lovely to get to know my patients, but it just doesn't change anything with our surgery and our techniques. Patients still get the same surgery, and it's irrespective of kind of what they want to look like or if they want to change parts of their face. It's just what we think is going to be the best results for our patient.
Yeah, I would encourage everyone to go look at the before and after on your Instagram and on the Bentali Instagram. Is just an amazing transformation of enhancing the look of men and women. And question is, who likes more facelift? Is it men or women? Because right now men are competing on everything. I think they finally realized that beauty is important to them as well, and aging affects them as well. So, do you see an equal number of men versus women that coming seeking facelifts?
No, not yet.
Not yet.
Women are still dominating. But I would say there are definitely more males that are coming in compared to before.
Mhm.
But it's still predominantly, I would say about 80%, at least in my practice, is females. and then 20% men. But it's changing. I'm seeing more male consultations, and it's great because they look very natural. I know they look very natural. They look very masculine. And sometimes there's like taboos saying like, oh, plastic surgery for men, they're gonna look more feminine, but that's not true. That's not true with our techniques and with our results. So.
Yeah, I know you're right. You're right. Men always are afraid that they're gonna look more feminine, or is she gonna change them to look too smooth, to look different. But I think someone is asking here, they're saying, is men facelift harder than women facelift? Is it?
Yeah, traditionally they've been known to be harder. Males are more vascular. They have bigger blood supplies to their face. So usually the surgeries kind of just a little bit takes a little bit longer. I wouldn't say it's harder. It just takes a little bit longer because their attachments and their tissues is just more dense. So because of those two reasons, often they're known to be harder. But I would just say they just take longer.
Hmm. I see. And which one whines more after surgery, men or women?
In my
Who gives you a
experience,
harder
honestly,
time?
yeah, no, in my experience, honestly, I've had lovely patients. I would say neither have really been that whiny. They've been really awesome and have really trusted the process because it is a long recovery. You know, it's 6 weeks and then up to 3 months of kind of swelling and stuff until you look your best. But they've really trusted the process and it's been amazing. Yeah, they
So
haven't been
I'm
too whiny.
seeing you have a lot of viewers that got excited that you're saying you were originally from Canada, and they're asking you, are you gonna go and operate there? They're kind of inviting you all over. So what do
Well,
you say to that?
I'm trying to convince Dr. Talley to open up a center there. So hopefully do bi-coastal, but we'll have to see what Dr. Talley says.
I see, I see. So, question, I go to Los Angeles pretty often, and I saw the beautiful center that you guys created. It's called Cupid, and it is mainly for lip lift. So, can you tell us a little bit more about lip lift? I know that you also doing great with that as well.
Um,
So, who does qualify for a lip lift?
yeah, so Cupid Lips is one of Dr. Talley's new centers. It's focused around lips and skincare and health, like skincare. In terms of the surgeries that are provided there, it's lip lifts, but they have outstanding NP and PA, Jen Hollander and Taylor Supiani, who focus kind of on skincare and non-invasive treatments. So my role there is in terms of lip lifts. So lip lifts are surgeries in order to kind of shorten the length of your upper lip. It's
Shorten the length between the nose and the lip?
Yes,
Go ahead.
exactly.
Okay.
So it's for patients that essentially have had deflation of this area of their upper lip called the philtrum, or have had elongation. So like the rest of the face, the lip also ages, and often loses a lot of volume here and around the lip as well. So it's for patients that don't have a lot of lip show, or teeth show called incisive display, and have an elongated upper lip. We make a little cut here and kind of shorten the length of the lip, essentially just to show more lip and just to get a little bit of teeth show, and it's quite beautiful, the results that we can get on the right
Yeah,
patient.
and how is recovery from this surgery?
The recovery, I would say, is a little bit more dramatic. The time frame is again the 3 months for all our surgeries. We say about 3 months until they get outstanding results. But you could look very swollen for the first few weeks up to the first 2 to 3 months, where it's very exaggerated. It looks like you had very bad filler. It looks like you've had some kind of allergic reaction. The good thing is that after COVID, patients could hide really well with a mask.
Oh, yeah.
So go back to work, they feel fine, they look fine with the mask on, but when you take the mask off, they see a little bit of kind of swelling on your upper lip. Things could kind of feel stiff for the first few weeks, but by 3 months that all resolves.
Does this make a person avoid lip fillers if they do the lip lift?
Not necessarily. There are patients that when they do the lip lift, they don't need more filler, but there are patients that already have a very small upper lip, so they can't get filler. So when they do the lip lift, it causes a little bit of more lip show, so then they have more real estate for lip filler without the filler moving away and causing kind of the mustache migration appearance.
I see.
So variable. Yeah.
I see. I see. And is there's an age limit to the surgery? Is there is
No.
no?
No.
However, that Yeah, and I see Dr. Talley and you, you refuse some patients and you tell them that the distance is not enough for a lip lift. I have noticed that. And so you really evaluate the case based on the general look of the person. And there's measurements here, right? That you
Yeah,
like to, yeah, yeah, go ahead.
sorry. Yeah, no, definitely. I mean, there are patients that aren't good candidates for lip lifts, and whether that's they already have too much teeth show, or whether they have too much, if they're veneers or they have their upper lip and chin and area is too recessed, they could actually accelerate aging. So there are
Mhm.
patients that we say we don't think it would look good, or it could actually cause problems down the road for you. So the criteria for doing a lip lift, we just make sure you have like it's a great candidate that's going to have great results.
Great. Honesty is everything about the surgeon. And I'm gonna say to everyone that would think of a surgery, especially any kind of surgery, and especially facelift and facial plastic surgery, they really need to review the surgeon, the group that they are going to operate. And I know that social media gives you a lot of mixed up understanding of how great the surgeon is, because pictures are cheap and they are available online and they can be not authentic. They really need to review the surgeon. They really need to. I love that you put life stories about your patients. You put real people who tells their own stories. The pictures that you're showing is real to cases that you have done in the past, and that helps a lot. So I think even the person who's seeking surgery needs to really look and look more into the surgeon that they are trusting in their face. Is that correct?
Oh, 100%. I mean, it's a relationship. I tell my patients the two decisions you have to make is one, whether you want to have a facelift. Actually, so I would say three questions. One is whether you're ready for a facelift, whether you have 3 months of downtime for recovery and just making sure that you don't have any big events. And third is choosing your surgeon. And those are the decisions you have to make. The rest of it, you have to trust your surgeon with. And I think it's a huge I think privilege for surgeons to be able to have patients trust them. I mean, it's your face. It's like
True.
it's to me at least personally. I mean, I think it's the most important thing in my aesthetic. So if I'm trusting someone with my face, it's such a big kind of it's such an important piece of me. It's the surgeons like are so fortunate that patients trust them, and I think it's such a kind of valued relationship and trust and connection that I think you really both ways. I think the surgeon really needs to feel comfortable with the patient, and the patient really needs to feel comfortable and feel like they can trust the surgeon. So it's very important. I would agree.
Yes, absolutely. And that's why I believe my followers trust my choices of people that I bring on my Instagram. And it is the people that I've known, I've seen, I've dealt with, I worked with, and I trust a lot. And that helps a lot. So one question that someone is asking, they're saying, what is your favorite lip balm?
Oh, I'm terrible. I'm terrible with this. I would say either Vaseline or the Dior lip balm. And then
Okay.
Cupid has an amazing lip plump
I
that
saw
I
that. You
love.
guys have a great line at
Yeah,
Cupid. Yes.
it's amazing. It's called the lip plump. I use that when I want to get a little bit more volume. My lips are a little bit on the smaller side, so the lip plump at Cupid is probably my favorite.
Wonderful. Anything else you would like to add? Thank you for your trust, Dr. Sarouj. I really appreciate you all, guys. And yes, I know she is a beautiful surgeon. I'm just reading fast through the comments. They're very active and they're loving you. So thank you all for following us. And if you need to do virtual consultation for international people who would like to come to Los Angeles for facelift, please feel free to send a message and we will connect you with Dr. Zia and arrange a virtual appointment. Actually, you can get a lot progressed and achieved over a virtual appointment. And I think for someone to come and do their facelift and leave if they are out of the country, since you host a lot international visitors. Would we say safe to stay after surgery 2 weeks, 3 weeks?
Yeah, 2 weeks would be great. The minimum is 8 to 10 days, but 2 weeks is great. Yeah.
Wonderful. And with the hyperbaric oxygen, the recovery is really, really well. And I'm so glad that you guys entertain this at the office, that you have the chambers and because I noticed recovery goes really faster with hyperbaric oxygen, especially for someone who needs to travel after 2 weeks.
Yeah, no, hyperbaric is amazing. Patients that do it kind of regularly over the first week truly feel amazing, and their swelling and their kind of overall recovery is significantly improved. So we're really fortunate to have 3 chambers here.
So I see a lady, I think she's saying she's turning 42 and she feels the aging, and she would ask if 42 years old and she's in her 40 would be fine to do her facelift. Do I have to do it again at age 52? What do you say about that?
So age again is really not like a factor. It's just a part of your demographics. I assess patients and see if they're a good candidate for surgery. So definitely happy to speak with you in consultation and just see if I think I could provide kind of you with the results that you're hoping for. And then in terms of what age you'd repeat it, that's very, very dependent on the patient. So on average, it's about 10 to 15 years. And that's patient dependent. I mean, it's not like everyone right at 10 years, they say they want a facelift. If you're kind of more flexible with signs of aging, you could prolong that. Some people only want one facelift when they're in their 50s and they say, I don't care when I'm in my 60s, 70s, it's fine. So every patient's different. So it depends a lot on you and kind of how you age.
Absolutely. And again, we say what you put inside you also reflect what's outside of you. So if you have and you've done a facelift to enhance your appearance, you need to take care of your general health, weight loss, weight gain, what do you eat, your lifestyle. It all affects the aging process of our life. So I think it is something we never have to forget about. Do you agree with me?
Oh, definitely. I mean, those things I have less control over what patients, what they do outside of the office. But definitely, I mean, just living a healthy, active lifestyle and kind of limiting kind of the toxins, definitely. Yeah, especially with smoking and kind of more kind of
Smoking and
severe.
alcohol, it aged people a lot.
Yeah, alcohol's kind of mixed. I mean, that one I don't have a strong opinion about. I mean, heavy alcohol definitely. But like a glass or 2 of wine a week, maybe that makes you more happy. I'm not sure.
Yeah. Okay, we will make them happy and say
Yeah.
so. But yes, I agree with you. Well, I want to thank you so much. We're gonna tag your Instagram to our account as well. I know you have a bunch of pictures you've been posting about before and after, and they can also look at your general practice with Dr. Bentali, and there's more for them to look for. And if they need an appointment, they can feel free to contact you directly or reach through us. We will make sure to facilitate everything from A to Z with you. I want to thank you so much for spending this time with us. And I look forward to meet you again over an Instagram live. Maybe we need to do this again in a couple months and ask more in-depth questions about the procedure, or maybe we can post more pictures in for them to see, or videos. I know you guys are very generous with your videos during surgeries and before and during and after.
Okay, well, awesome. Well, no, the privilege is all mine, and I'm so grateful to be here with you. It's actually such a pleasure, and it was so great seeing you. You also have to share your beauty secrets with all the followers.
I will. I'll try.
Well,
Thank
thank
you
you
so
again.
much for this meeting, and we appreciate you. Have a great Friday and a great weekend.
All pleasure. Thank you so much.
Thank you all.
Bye.
Thank you all for being there with us, and we will post this in a minute, and it can stay there for everyone to watch. Thank you. Thank you.
Awesome. Thank you.